Hi, my name is Logan Charmatero. Today we're going to be talking about Olympic weightlifting and the injuries involved in it. For population of Olympic weightlifting could vary from anywhere from 6 to 8 years old all the way to 80 years old, both male or female. But today specifically we're going to be talking about ages 16 to 30 years of age in the male population. Environmental factors for Olympic weightlifting injuries could include equipment failure, poor technique, poor warm-up, too heavy of weight. We want to make sure technique's on point before we get into any weight. Equipment, check before and after every lifting session. Make sure the coaches are adequately warming up all athletes, and then progressing them to a weight that is comfortable for them for their training session. First one we're going to talk about is lower back pain, more specifically a bulging disc. Lower back pain, Olympic weightlifters oftentimes a bulging disc or degenerative disc disease. The disc and the spine are located between each vertebrae, and with Olympic weightlifting, it puts a lot of strain on them, weakening them, often causing the disc to bulge, which pushes against the nerve to cause pain. Mechanism of injury for lower back pain: flexed spine while supporting weight. This is including, like we see a lot of deadlifters deadlifting weight and their spine is flexed. That could increase risk for injury, strain, or a bulge disc. And then heavy loading of the spine repeatedly. We want to make sure that athletes are taking deload days or deload weeks where they're lifting lighter weights, just doing movement and just body movement, not just loading the body with heavy weight. Here we have a picture of some lower back pain causes here. They call this a butt wink or just tight hamstrings. So we see in the bottom here on the right hand side we have a flexed spine at the bottom of a squat. On the left side we see a neutral spine or a slightly extended spine. Anatomy and assessment of a bulge disc. It refers to the cartilage in between each vertebrae. These are made out of a fibrous tissue that could be torn or pushed out and bulged because of compression that pushes against the nerves. The nerve pressing against is what's causing the pain. So for the assessment of this, we want to check nerve function. So all distal functions of extremities. We want to check muscle strength, any sort of weakness on one side or the other, and then of course pain on palpation. Rehabilitation, preventive exercise for lower back pain, for disc injury, is going to be a pelvic tilt. We're going to go over all these at the end of the video in video form. We're going to have these presented to us with a volunteer. But we have a pelvic tilt and 2 sets of 10 daily. We're going to do 5 repetitions in the beginning for progression, and then we can up to 10 reps. We're going to do the bridge, that's 2 sets for 20 reps daily, minimize repetitions to 5, and then progress, same thing, non-weighted. So lastly, we're going to have a plank hold. So all these you can see are focused on tightening the core. We want to make sure the core is tight and taking off that pressure of all the strength coming from the lower back. So treatment 1, from least invasive to most invasive, we're going to start with the epidural steroid injections to the nerve to reduce pain. So you want to make sure when we have that epidural steroid injections, that's not fixing the problem, but it's going to be able to open up a window where we can rehab this using these exercises, which could push the disc back in. Treatment 2, we're going to do minimally invasive discectomy. This surgery is where they cut away the bulging disc that's pressing on the nerve. So this obviously is going to fix the problem in short term, but we want to make sure that we do these exercises to prevent the disc injuries from ever occurring again. Next injury we have is going to be a slap tear. It stands for superior labrum anterior posterior of the shoulder. This is a very common injury where the labrum ligament of the shoulder girdle is oftentimes torn, partially or fully torn. Here we have an example here in both of these pictures. Mechanism of injury for a slap tear: we have weak rotator cuffs, constant shoulder stress, poor warm-up, internally rotated shoulders, and poor shoulder mobility. Most importantly, we have weak rotator cuffs. We don't want to put an athlete having weight over their head that they cannot handle. We want to progress to heavy weights. Next, we have mobility, which is one of the most important aspects in Olympic weightlifting. We see in that top picture here on the left-hand side, we have a female putting good weight overhead, and she has a good positioning in her squat and her shoulders. The gentleman on the right there is very forward on his torso. You can tell his mobility is externally rotated on his shoulders, which is a poor positioning for first-time Olympic weightlifting athletes. And we can see some presentation there, some overhead stability work. Anatomy and assessment of a slap tear, most importantly, is just going to be pain. The head of the upper arm bone fits into a rounded socket in your shoulder blade. The socket is called the glenoid. Surrounding the outside edge of the glenoid is a rim of strong fibrous tissue called the labrum. This tissue can be torn, causing a slap tear. In this video here that we'll go over at the end is called the O'Brien's test. That can indicate whether the person is experiencing a slap tear. Rehabilitation, preventive exercise for slap tear. We have an arm clasp, 4 sets of 20-second hold, once or twice daily if allows. Hold a towel if you need to for progression, if you cannot reach your hands behind your back. Shoulder rotation, 1 set, 10 repetitions, once or twice daily if pain allows. Minimize repetitions if needed, so cut down to 5, or just do no resistance depending on the point of rehab where we're at. Shoulder flexion, 1 set, 10 reps, once or twice daily. Minimize repetitions if needed. Here we go for treatments. For treatment 1 of that, we can do the steroid injections. Obviously, this is just going to mask some pain and take down inflammation so we can be able to rehab this injury. Treatment 2, we have surgical interventions. If significant pain increases after all of the treatment, surgical intervention might be needed. This is where they can go and repair that tear. Lastly, we have patellar tendonitis, is inflammation of the patellar tendon due to constant squatting, and Olympic weightlifting has a lot of squatting involved. Mechanism of injury for patellar tendonitis, we have forward tracking knees. We want to make sure that our knees are equal to our foot and not over tracking excessively, putting strain on that patellar tendon. Lack of warm up, obviously, we want to make sure that the body is fully warm before performing these squats. And then tight quadriceps and hamstring muscles. We want to make sure that we're all stretched out and constantly working on mobility. And then inadequate patellar tracking, we can see in that picture there that has the bad and the good. We have our knees equal there and pushing to the outside as we're squatting. And then we have the bad knees, which are internally rotated medially. Here we have a little anatomy here, patellar tendon there on the bottom, quad tendon up top. You can see if those quad tendons get tight, it's going to pull that patellar tendon. Anatomy and assessment for this, pretty straightforward. It's just going to be pain on the patellar tendon. Ultrasound imaging can diagnose this. MRIs can sometimes diagnose this. Patellar tendonitis is inflammation of the patellar tendon with an original origin of the top of the tibia of the patella. That's the kneecap. All right, here we have exercise demonstration. So if we go down to the exercise demonstration here, we can go over the different exercises. All right, I'll take the sound off here so I can just narrate as we have our volunteer go through these. You can see she's going to lay flat onto her back, knees slightly bent, arms down by her hips there. And what she's going to do, see she lifted up her back on that one. You want to make sure that lower back remains, and we're just tilting that pelvis up. It seems like a very simple exercise, but this can push that disc back in and strengthen that lower back. Our next one, as she's laying back down, same position as the pelvic tilt, but this is going to be a bridge. What we're doing is bringing our hips up and then leaving our shoulders intact, and this is going to strengthen our core here. Here we have a plank hold. She's going to hold that and just tighten up the core. You want to make sure that her buttocks and hips do not fall down and cause a hyperextension of the back. We can see our volunteer now is going over and getting into a seat, just a regular chair in the kitchen there, or any sort of chair where you have a table. She's going to place her elbow there about 90 degrees and externally rotate, and that's going to be working on mobility and also strengthening. You can include resistance bands if needed for these exercises. Next one, we have our arms down by our side, and she's going to go ahead and pull her arm up here. This is going to be shoulder flexion, so we want to put the arm overhead. You can see here that she's going to pull up and just go straight to equal her ears there. You can do this resisted, non-resisted. You want to make sure that you have good positioning and are stretching that arm all the way up. Next, we have, here's the single leg extension. She's contracting that quadricep on the way up. You can do these resisted. I know there's a machine at the gym that has these, but to heal that patellar tendonitis, you just want to focus on movement right there. Then next we're going to do a lunge here. This is where she's making sure she has her shoes and everything off. You can see how her knee is not forwardly tracking, it's remaining neutral. Up and over, there we go. One exercise I forgot to mention for the slap tear. So this is the arm clasp here. This is really focusing on mobility, but see how she can grasp her hands behind her back and raise up? That's going to stretch out that posterior deltoid there. Be able to heal that whether you've had surgery or you're just rehabbing that slap tear. So yeah, follow the repetitions and stuff here, and you will be, preventing any sort of injuries or anything. Olympic weightlifting can be a very smart sport if performed correctly. So thank you very much for listening to my presentation.